Lenox Hill Hospital is 154 years old. We've been taking care of patients here in the city since 1857. And it's really quite amazing when you think about it. It's longer than the Brooklyn Bridge, it's before the Statue of Liberty, it's before the Waldorf Astoria, it's before Grand Central. So Lenox Hill really is one of the oldest institutions here in the city.
Lenox Hill Hospital is a historic landmark in the city.
And it has served all New Yorkers, rich and poor, even famous actors, famous politicians, and famous sports heroes.
Taking care of New Yorkers for over 150 years.
I believe that our affiliation with the North Shore LIJ system has really positioned the hospital for great things in the future.
The hospital became part of the health system in May of 2010. So it's been almost 18 months.
We have hired over 300 people. We've spent or plan to spend over $150 million, all to build on the legacy of greatness that Lenox Hill had and will continue to have in the future.
Now with the influx of additional resources from North Shore LIJ, what you have developing here is a synergy of such great strength.
That's an incredibly important affiliation for us. It's going to enable us to make a series of investments in both people and technology. Probably the single most important asset of Lenox Hill is not the bricks and mortar, but rather the nurses, the physicians, and the staff. Over the course of 154 years, they've really been the difference in terms of the quality of medical care that the hospital's been able to provide.
Lenox Hill Hospital has a long history of high-quality care, and our master plan is to build on that long history. And to expand and grow our services. We'll be building new procedure rooms with hybrid capabilities.
We have invested in cardiac. There are upcoming investments in neurosurgery, in oncology. There will be other investments in upgrading the facilities, like the operating rooms.
Bringing them up to standard on size, improving and increasing our recovery room space, and upgrading all of the equipment to the latest technologies. Maternity and pediatrics is another area where we have a long history of care here in the community. And you have to have a strong and healthy obstetrics as well as pediatrics program in order to be able to fill that mission.
We facilitate more than 4,000 births per year and have even become a major destination for celebrities.
We have classes offered 7 days a week, which include infant care, preparing for life at home, and breastfeeding. We have a great lactation education and support program. We also have a warm line for patients to call if they have questions about breastfeeding or baby care after they're discharged.
Our maternity services consist of LDRs, which are modern labor, delivery, and recovery rooms, a high-risk antepartum unit, 3 operating rooms, a postpartum unit, and the Well Baby Nursery. We also have a Level 3 neonatal critical care unit for our high-risk neonates.
We have plans to triple the size of the neonatal intensive care unit over the course of the next several years. So we're very excited that in the first quarter of 2012, we will reinstitute a pediatric service here at Lenox Hill to be able to more fully and more completely service the community. Orthopedics is another area where we have a very long history of high-quality care in the community, rooted in sports medicine. But also the Nicholas Institute of Sports Medicine and Athletic Trauma. So the orthopedic service line is a great example of an area where our services span both of our facilities, Lenox Hill and Manhattan Eye and Ear, to be able to perform the complex surgeries that we perform on both hips and knees, as well as other joints like hands and wrist.
Lenox Hill's emergency department has evolved in the last 4 years. We're a group of emergency medicine residency trained physicians who are also board certified.
We're continually striving to make changes to improve patient care and really develop best patient care practices.
And that's important because we put the patient first, and it's about patient safety and patient satisfaction.
In fact, we've won an award for most improved patient satisfaction scores from Press Gaining.
In 2000, Manhattan Eye and Ear, the 64th Street location, merged with Lenox Hill Hospital.
That facility is going to undergo a major transformation. We will be upgrading that facility, bringing in new services, expanding current services, and creating the #1 ambulatory outpatient facility in Manhattan.
So we'll be investing in growing the Head and Neck Institute. We'll be bringing pain management into the Manhattan Eye and Ear location. Ophthalmology services, which have been there for many years. Our plans are to grow and expand the types of services we provide in eye care. In addition to those services, we'll continue to expand and grow our services in plastics and reconstructive surgery. All of these programs are supported by our ambulatory surgery suite. We currently do over 20,000 procedures at Manhattan Eye and Ear, and we will likely double that as these programs continue to grow. The mission and the vision is to provide care that our patients can understand.
Understandably, many West Side residents were upset and angered by the closing of St. Vincent's Hospital.
I used to work as an emergency room attendant at St. Vincent's Hospital, so it was very sad for me to see this traditional historic institution of so many years closed down. It really created a lack of access to health care for many of the residents in the Chelsea West Village community. So it makes me very happy to be able to come back to this community and be able to provide health care.
We are going to be building something in Greenwich Village that hasn't been done in New York City before. This is unique. This is the first of its kind. We will be opening up a Center for Comprehensive Care, which will include a full comprehensive freestanding emergency department, but it will not have a hospital on top of it. Remember also, it doesn't stand alone in the sense that it's part of a much larger healthcare system.
The reason we can't bring a full-service hospital back to the neighborhood is because it's just not financially viable.
North Shore LIJ produced a realistic, concrete plan with real dollars behind it, more than $110 million.
Lenox Hill has stepped in as part of North Shore LIJ and decided that it wanted to take over the O'Toole building, which is one of the historic buildings down there, and convert it into a major healthcare facility.
The Lenox Hill Comprehensive Care Center will bring 400 permanent jobs to the neighborhood. We're absolutely confident that that's not only going to help the existing businesses, but bring new businesses back to the neighborhood and fill those empty storefronts that we lost, 18 months ago.
Having these critical resources available in a neighborhood facility could mean the difference between life and death for patients experiencing a medical crisis.
So building what we can and bringing the best of what we can offer in healthcare is exciting. So we do emergency care really well at Lenox Hill, and we're going to bring that to the village.
We just don't do things for the short term. One of the characteristics of any good organization is long-term sustainability. So we are not about to put a major investment into the Greenwich Village facility, but without the intent of making sure that that continues for a long period of time and becomes a major program and a major facility for future generations of people that live in that region. You can come to the facility, you can be assessed, you can be taken care of and be sent home. And for the small percentage of the people that need to be put in an inpatient facility, they can be transported.
I'm very proud of the fact that we've come through a very difficult 15 or so years for the hospital, but I really believe that we're positioned today as strongly as we ever have been to continue to provide wonderful medical care for the people of New York. I'd like to thank Michael Dowling and the rest of the system staff, as well as the staff at Lenox Hill, for their help during this 18-month transition period.